Good afternoon, everybody. I'm Joe Parisi, and thank you so much for coming here to take part in the 5th of 6 economic summits that we've been holding across Dane County. Today's topic is healthcare, and that's everything from folks like we have here at Epic who deal in healthcare software to people in the direct care business and everything in between. What we're going to do today is Jody from In Business Magazine is here, and she's going to be facilitating the meeting. And what we're looking for is input. It can be, now if you're not in a healthcare related business and you're making this because this is one of the forums that you're able to attend, feel free to speak up, give us your input, let us know your concern. We're focused on healthcare today, but we certainly want to hear from everyone. So don't feel shy about standing up and asking questions or giving input if you're not in a healthcare organization. When you came in, you filled out, and some of you are filling these out at your desks, a registration form so that if you know you want to speak, feel free and circle yes, I want to speak. If you change your mind and you didn't circle yes, just raise your hand, and we're happy to hear from everyone. Jeff from my office will be around in a little bit to gather those from you, and he'll bring them up front. Also, there's a survey in the back, if you haven't filled one out yet. We're going to be asking some somewhat general questions today, but the survey goes a little more in depth. We appreciate it if you could take some time to fill that out and hand that in, or if you're unable to do so, we have that survey online at prosperitydane.org, and so please feel free to go to that website, fill out the survey with any information you want us to have, and if there are people you know who aren't here today or who haven't been able to make any of the summits, who have information they want to share with us, please let them know that we welcome their input through the website also. The reason that I've been holding these forums is kind of twofold. Obviously, as everyone in this room knows, Dane County's economy is certainly not immune to national and international economic downturns like we once at least felt we were. And so I think it's time that Dane County government becomes more active in economic development and supporting the businesses that we do have and making Dane County an attractive place for new businesses to move to also. To that end, I will be creating an economic development entity in my upcoming budget that will be introduced on October 1st. And the information I gather from these summits and from your input and from the online surveys will be used to help inform that position, the creation of that entity, as well as the direction that entity may choose to go. We've had some great input so far, big picture, little picture. What we want to know from you today is, what do you think? How can Dane County help? You know, what works right now? What doesn't work? What kind of works but could use a little help? Where are there gaps right now in economic development? And feel free to think outside the box. Everyone may be familiar with what county government does right now. We do human services, we do land use, we plow the streets, we have a sheriff's department. So is there anything within what our current duties are now that could help? But also, is there another role that this entity could play that's not traditionally thought of as the role of county government to do, having to do with coordination or whatever that may be? I'm not going to throw too much out there because I want the information to come to you. So thank you again for coming today. I really appreciate you being here. I'm going to the greatest extent possible, just sit and listen today. If you have specific questions you need to hear from me about, feel free. But the purpose of today really is to get input from you and to give you a chance to tell me what you think we need that could assist Dane County in remaining economically viable. So I'm going to turn it over now to Jody from In Business Magazine. And Jody, thank you so much for being here today and helping us out. We appreciate it. Thank you.
Thank you. I really would like to, I have a lavalier mic. Is that loud enough?
Mm-hmm.
Yeah, I think it is. I'd really like to begin, obviously, by thanking the County Exec, Joe Parisi, not only for inviting me to host this, in a sense, but also for having it here at Epic so that so many of us get the opportunity to be inside this beautiful building and learn more about Epic, but to open his ears to the opportunities for economic development in the county and the role that you could play, and inviting public input on defining that. I think that's really a critical turning point, is just inviting business to the table. And when we started talking about how we were going to frame the summits with all of the moderators in a room, I felt like I really had the hardest one, because I'm thinking of healthcare in terms of a deliverable. as a product. And I'm thinking, how is Dane County involved in that? And is that what we're going to talk about? And then, I was kind of drawing a blank. And then someone said, well, if some of our biggest employers are in the medical industries in Dane County, and I went, oh, the business is involved. Oh, now I get it. So what we're going to do today is not frame it in any way, but to understand that some of you are employers in the healthcare field and you want to have your business flourish in an economic development situation that's favorable to you, helps you be prosperous and get some regulations in your favor or out of the way, whatever. You might have some interest. Someone else might be looking at access to healthcare in Dane County. Someone else might be looking at educational opportunities in healthcare in Dane County. I know we have a recent nursing grad sitting in the front. So I'm not going to frame this in any way at all, but rather learn what your interests are in the general area of healthcare. For some housekeeping things, first of all, if you have a cell phone, might be a good time to think to turn that off. I happen to think to turn mine off, or I would forget that, and then you're going to be embarrassed because that song that's so cute with you and your lover, not in a big room, and it's going to be recorded. So the other housekeeping piece is that I'm here to listen to you. I'm really not up here to entertain you because I would fail miserably, and I'm not up here to educate you because I look around the room and hear the educators in the room. So your microphones have to be working, and all you have to do to talk today is to touch your button and your microphone will be active. We ask you to lean into it because Dane County is recording this, and that way they will benefit from the wisdom that you're sharing with us today or the questions that you have. And without that, you may not be able to pick it up and then it won't be recorded. Just remember, when you're finished talking, you might want to hit the off if you're making remarks to a friend. Another good piece of housekeeping advice. Also, the third piece of housekeeping advice is, I think I greeted many of you by name when you came in. I see so many familiar faces and people that not only do I care about, hi Fred, but people that we have done business with at Business Magazine, and I've done over 1,200 radio shows, so many of you are familiar. Now, as we progress through this day, I am going to look at you and completely blank on your name. That is just what's going to happen. Even though I know it when I'm calm, I'm going to get excited in the moment, I'm going to go blank. So if you raise your hand to make a point, and I look at you and I know Chris, and suddenly Chris, your name, I'm just going to go yes, and don't be offended. That's the only thing I ask. Because otherwise you come down here and do this. You'll see what I mean. So we are prepared to start. This is an open listening. The county exec has asked me to remind you that he's not here to answer questions in the sense of, yes, if you just need a point, he could do that. But he doesn't really want to turn it into a press conference. For him, he really does want to listen. And so do I. So we'd like to start the listening portion now, if anyone would like to start with an open framing question. Otherwise, I remember enough names to call on you. Yes. And then just push your mic and lean in.
Not a question necessarily, but an observation maybe for other comments. If we start a new entity in Dane County, there have been many, many entities started. In my experience in watching them over the years is we see a problem, we go out and find a model that seems to work. We adopt it, we invest in it, then we measure the results, and invariably, way too many times, the results aren't there that you expected at the beginning. Even more than that, you ended up adopting the same model everybody else adopted, because that's what's being written about. So I would, in terms of other people's comments, if you're going to do something in Dane County, it ought to be A, integrated with other things that are already going on, and B, it should be really innovative. If you only adopt what other counties, cities are doing, you're really not moving us forward or even making it individualized to Dane County.
Excellent point. Jim, do you have a comment about that and integration in terms of healthcare services to keep this going a little bit?
Filler. Is that what you're saying? You know, fill the
No,
time
I'm
a little
saying
bit?
that I know your position on the integrated healthcare delivery.
Yeah, we, in terms of that specifically, I think what our community is looking for, and what our community has, first of all, maybe to start out with that, is that we have a number of excellent healthcare institutions and physician providers in our community. The quality is very good, the costs are generally quite low, and we stand out as a state. Last year, Wisconsin as a state was recognized as the #1 state in the country for overall value of healthcare as measured by the level of quality versus the cost. So I think we've got a lot to be proud of, yet in saying that, we're not perfect. And all of the healthcare institutions are grappling in various ways with how do we prepare for what's coming down the road just a couple short years from now with national healthcare reform. And what most organizations are doing right now is either they are an integrated delivery system or they're developing and becoming more of an integrated delivery system. And I think that the major focus of that, especially is for those of you who know me, I'm the CEO of Meritor Hospital, and what we're focusing on is we need to expand the access to our services rather than being focused primarily on Park Street. So we've been expanding clinic locations with a focus on primary care, which is still, despite the quality of care, despite all the resources, still a very significant issue for our community. Waiting 6 months for a primary care appointment is too long. So we are doing our best to try and expand the number of providers, but also the number of clinic locations. And what's new for our organization is we've been a hospital, we've been an insurance company. We continue to be those two things, but what we've added that's different is we're now becoming a medical staff, employed physician group, which is a national trend that's occurring. All of that's designed with the idea of becoming an integrated delivery system to better respond to the challenges we're going to be facing with healthcare reform, which is we're no longer going to be paid based upon the number of services we provide. We're going to be paid based upon the value, the overall quality, and the outcome of the services that we provide. So for the last 40 years, we have worked under a very specific system of how healthcare is provided in the United States, and that's poised to be tipped on its head. So a lot of what you see, I think, in our marketplace is everyone positioning themselves as best they can to survive and thrive, hopefully, in a new environment, but also to respond to what a lot of our specific county and community needs are with regard to access to care.
How can the county help you in that, Jim? What, in any way, whether existing avenues, whether influencer, whether new avenues, when you think of the county, how does that impact anything that you're doing?
I think this forum is excellent. And I think that one thing the county could do that probably the city can't as effectively, City of Madison can't as effectively, is provide a forum for ideas and for exchange. Now, there's lots of little groups that do this, but I would say that there's not necessarily a forum that reaches throughout the county and involves employers. We have the dubious distinction of being a healthcare provider, a healthcare insurer, and an employer. So we're experiencing everything that others are experiencing, plus we also happen to be at the delivery end and the insurance end. So providing a forum for engagement of providers, but also employers and patients, the community at large, I think would be a dynamic thing to try and accomplish, although I recognize that's not easy. But I think all the providers at the table, the insurers at the table, in some vehicle, some forum for exchange of ideas, and looking at the problems that the county is going to be facing comprehensively rather than from our own box where we sit. I think that would be something that the county could hopefully facilitate.
Great. Any comments? Yes, Chris.
I'd like to just build on Jim's comment from the standpoint of what can the county do, and his suggestion that the county leadership can provide a forum for discussion of important issues. I generally agree with most of what Jim shared in his comment, but I would just underscore one thing that Jim mentioned, and that is the opportunity we have to do better in this county. While we do have very well-regarded and very high-caliber provider organizations, and while we have high rates of insurance and insurance delivery in this marketplace, on a per capita cost basis, Madison does not compare favorably to other regions in the state. Most notably La Crosse as an example, which in one very well-regarded way of looking at healthcare cost and utilization, the Dartmouth Atlas is the lowest per capita cost region in the country in terms of end-of-life spending. And one of the facts among many that probably will get cited in the context of comments today, a high percentage of Medicare costs are incurred in the last 6 months or 12 months of life. And one of the reasons why La Crosse has performed as effectively as they have on that indicator is that the healthcare providers, faith-based organizations, local government, other stakeholders came together many years ago and promoted the adoption of advanced directives among a high percentage of the population, which I think is playing a significant role in reducing per capita costs at the end of life. And what we lack in this community seems to be a forum, a mechanism by which stakeholders can come together and really grapple with difficult issues related to the organization, the delivery, the provision of care, and the costs of care, because we are, as is cited routinely at a national level, sitting on a time bomb in terms of the costs of healthcare in this country and the opportunity cost that it represents in terms of what it takes away from other equally compelling and important sectors of our economy, such as education, housing, and infrastructure development. So I think the county could play a very critical role in building on the forum today, building on some of the ideas that Jim introduced in his comment, and really step up to the plate and make some difficult decisions about how we allocate scarce resources.
And Chris, can you give your full name and then your organization?
Oh, I'm sorry. My name's Chris Quarum, and I'm with an organization called the Wisconsin Collaborative for Healthcare Quality.
And I'm going to ask everyone to do that. I was remiss in not suggesting that in the beginning so that the comments are grounded, and mostly so that all of you can understand the source and the research behind, because you lead in collecting those metrics statewide, so that's very important. Nino, you were making notes. Usually that means that you have something to say.
I thought you'd forget my name. Well, no, I
And name and organization, and push your little button until it's green. There you go.
Nino Amato, President of the Coalition of Wisconsin Aging Groups, and we've been very much involved in healthcare issues. And with advanced directives, when this was first proposed to the state legislature last year, we very much wanted to support it. Unfortunately, there was not enough consumers at the table when they drafted the piece of legislation, and it had too many ambiguities. So between Disability Rights Wisconsin and CWAG, we stopped it from being passed. But we very much support the model and want to sit down at the table. So I think, both what Jim has indicated as well as Chris, that using this as a forum to have those very frank discussions is really critical. And I think, quite frankly, the greater Madison-Dane County area could become a leader, because we have the intellectual capacity, and I think there's a certain amount of healthcare entrepreneurial spirit to do what's in the best interest of the patient.
And we have the cooperation with
Sure.
you, too.
Just for the record, both Chris and I are Meritor alums, and I've had the opportunity to serve at Meritor Health Services over a decade ago. And I've also had a chance to see academic medicine and how it works after serving on the UW Hospital Authority Board. And there are two different cultures, two different approaches, but all complement each other. The key is how do we get there together in a collaborative way.
And so the function for the county, again, is the forum builder.
Being that catalyst. And I think they can bring a lot of people together to have, again, the kind of discussion that's really needed. Because we are all fending for ourselves at the moment, just given the wave of changes occurring, especially with the Affordable Care Act. And I think the biggest thing that we are advocating for is to make sure this time the consumer's at the table. We look at bending the cost curve, and key is Chris's organization on the whole issue of quality outcomes and measures. And as Jim pointed out, the fee-for-service is a thing of the past. Now the question is, how do we get there? So I think the county can play a very important role.
In the role of forum builder and connector, one of the questions I would have for anyone else who tips their hat in this direction, and a question I would have for you three as well, is who should the county invite to the table to make sure that you feel that that is a comprehensive panel? Because we're hearing from three, but you might be able to identify someone else that you've had difficulty bringing to a table or feel parity at a table with, that if the county were to call that, maybe that would be a little easier. So what advice would you give the county exec as to who should be invited to that table? Nina will start, and I just want to do a sweep back, and then we'll move beyond that.
Well, that's a tough question. I mean, we could easily have a big tent philosophy and bring a lot of people to the table. In many ways, that's the way it's done in Madison and Dane County, and there's nothing wrong with that. I think what you want to do is, though, is to develop a framework, principles of understanding, decision-making, and also do our due diligence as to what are the issues facing Dane County and what are the best in class elsewhere. I think one of the areas, obviously, we could focus on where I think there'd be very little disagreement on is what Chris pointed out, and that's the end-of-life decisions, where a great deal of cost arrives. And then you have us baby boomers, which you're one of us, and you know, having been caretaker for both my mom and my father, and after talking with a lot of other baby boomers, we're not going to go out the way our parents did. So besides of making advanced directives and end-of-life decisions, there was another issue that a lot of people don't want to talk about. And that is, do we have the right to make our final determination, especially if we had an illness, disease, that it's just a question of time before we're going to pass on, and how do we want that to happen? And I think that form would be a good one. So I think the key is you need to develop a framework, so you have a policy decision tree. I think important is to have a lot of the consumers at the table, knowledgeable consumers, not people who just want to pump their own, but are aware of what it is to be a caretaker, and create a system where you have enough say, but you don't have to move at a snail pace. I think both Jim and Chris have pointed out, time is of the essence. Our system is unfortunately broken. It's dysfunctional at best. And with what's coming with the Affordable Care Act and the divisive politics, unfortunately, in Washington, we either have to get it right ourselves or someone is going to force it upon us.
Chris?
Back around. Just a couple of comments. I use the phrase multi-stakeholder, and I do think that is probably typical of what we have here today in terms of a pretty broad segment of the community represented. But I think it's critically important, maybe to say what Nino said a slightly different way, to have organizations that can help reach the population at large, the lay public, consumers, however we choose to describe them, because I think there are so many myths associated with healthcare that we're going to have to try to change. Easy example of that is the perception that more care is better, or that higher cost care is somehow higher quality care, when we know from many other segments of the economy that rigorous adoption of industrial strength quality improvement models can reduce variation and improve quality while reducing cost. And so when I think of organizations that can have influence with consumers, it's groups like Nino's, it's AARP, it's labor unions, and I mentioned one earlier, faith-based organizations. I think when I look at some of the multi-stakeholder forums that we help to catalyze, that we help sponsor, that we're a part of, religious organizations tend not to be a part of the equation, and I think can play a critically important role in reaching that segment of the lay population.
Great, thank you. Jim?
I agree with everything they just said, but I guess I would say it does depend on the questions we're going to be asking, and maybe the set of questions in that first year are going to be very different than the set of questions 2 or 3 years out. And I do think it's a longitudinal kind of process that we would be entering into. I think Chris makes a very good point about learning from what other markets have done in the state and maybe in the Midwest around advanced directives and things like that. We all deal with that issue on a personal level and an organizational level. But I also would like to see at some point our collective ability to educate the community a little bit about what's at risk in the provider network, the healthcare services that are provided in Dane County today. What's at risk, what's vulnerable, and how can we prop that up going forward? And it begs probably a much more political, much more financial and challenging kind of discussion, but in a market our size, do we need, and I'll put our organization out there as an example, can we continue to be everything to everybody as the 4 hospitals are, including the VA? Should we all have an open heart program? Should we all have a neurosurgical program? Quantity and quantity of procedure is going to lead to quality of outcome. And if we're distributing volume over a wide number of facilities, is that wise going forward? That you can understand how touchy that would be for a lot of different reasons. But I would like to see a body that is highly educated, highly involved, and is looking at something rather than our own insular kind of look that we have a tendency maybe to focus on too much. But what would be best for the county if you look out 10 years? What would or should we try and gravitate to in the future? So I think it depends on the question being asked, and I think you have to start small before you're ever going to get to those very substantive issues. But I think they're going to be foisted upon us much sooner than we probably any of us would like to address. And the last comment I'll make, and this is for others in the room who are maybe less familiar with hospital care today, but I would ask you to maybe apply this to your own businesses or where you work, that what a lot of people don't realize is that the average hospital in the country, and this is true I think for the hospitals in Madison, 50% of the healthcare services that we provide are provided to government payers, Medicare and Medicaid, and neither Medicare nor Medicaid pay our cost of care. We're not talking about charges. What we charge is really irrelevant and has been irrelevant for years. But if it costs us $1 to provide services to you, Jody, if it's Medicaid, we're getting around 30 to 40 cents of that dollar. If it's Medicare, we're getting about 60 cents on the dollar. So for half of our business, we lose money every day. And then you add to that charitable care and community resources that we as not-for-profits provide back to the community. That's all at risk. And I don't know what that looks like, and I don't think any of us do. I think we have lots of nightmarish examples. But I think we're all striving to get to whatever that endpoint is in 10 years in the most successful way possible. But that education and understanding where the health network is at risk, I think would be a helpful exercise too.
Yes, Cheryl. I'm Cheryl DeMars with the Alliance. We're a not-for-profit employer-owned healthcare purchasing cooperative here, headquartered here in Dane County, although we cover all of south central Wisconsin. But we were started in Dane County, and that's where a majority of our employers who provide health benefits to their employees live and work. And I have a couple of comments just playing off of some of the discussion thus far. When I think about what the role of healthcare is in terms of economic development, I don't think so much about how we can grow healthcare or how we can expand the healthcare sector, but rather what we can do to make healthcare a competitive advantage for businesses so that we contribute to economic development. And although on national surveys it's true that Dane County and Wisconsin as a whole might compare well, there's a lot of room for improvement. And in terms of costs, it's cold comfort to employers to know that other places have it worse. The fact is costs are too high. And we're spending a lot on waste and poor quality that we need to get after. So in terms of how the county can help, I think there are several things. First of all, the county itself is a purchaser of healthcare services. And as the Alliance, we're focusing on value-based purchasing strategies so that we create the kind of market that recognizes and rewards better value providers. We would love to be working in partnership with the counties in all of our service area, and the state to collectively align incentives for better value healthcare. I think that's one place to start. Jim mentioned the dicey topic of, do we need all of the healthcare infrastructure and all of the duplication of services that we have? That is a tough question. And I think what I would like to see us do is get beyond kind of rhetoric and newspaper headlines and figure out a way to get some objective data to answer the question, how much of what type of healthcare infrastructure do we need? I think the business community as well as consumers would value having that kind of a perspective, and maybe that's a role that the county could help with as well. And finally, I appreciate and applaud the desire to focus on economic development in Dane County, and would encourage the county, as you go to set up this economic development entity, to be coordinating efforts with entities like Thrive, who are similarly focused with Dane County as one of a broader set of counties that we're working together to drive economic development.
Great, thank you. And before I go back into the audience, I do have a note that Dr. Loving wanted to make some remarks, and Ken Loving is with Access Community Health Centers, and certainly because he can speak to access and the need to access affordable health care, I'd like to turn it over to him. I don't even see you, where are you?
I'm right here.
There you are, back here.
Can you hear me? Yes.
Yes.
Thanks for the opportunity. I'm the CEO at Access Community Health Centers, and we provide medical, dental, behavioral health, and low-cost pharmacy services, mostly to people that live in poverty in our community. And I certainly agree with what's being talked about, and I think that our efforts need to be extended to the group of patients that we serve every day, so that they have a chance to be part of the economic development activities in Dane County. They have a chance to become productive members of the workforce in Dane County. When I see patients in our clinic, the greatest hope I have for them is that they can get to a point where they can have a job that's rewarding and that earns them a decent wage, and they don't have to work 2 or 3 jobs to get by and provide for their families. And I think one of the misperceptions is that the people that we see don't necessarily work like a lot of people do. The reality is many of them work several jobs and very long hours to get by and to support their families. And so I really see a lot of the work that we do as a healthcare organization and the other healthcare organizations in our community as preparing people for the workforce and preparing people to have a more productive life and be able to contribute more in our communities. And just the other thing I wanted to say too is I think that to do that in an effective way and to really focus on this group of people, we have to focus on the areas where they live and where there are concentrations of poverty in our communities. And I think the one that I've been thinking most about recently is South Madison, because I think that that's an area where a lot of people initially enter our community, and the rates of poverty and the rates of education and the rates of disability are very different from other parts of our community. And so I think that to really make a difference with those folks, we have to focus on their neighborhoods, on their priorities, and on the schools where they educate their children.
How would you see the county being your partner in this versus the city of Madison?
I think that we need both of those as partners, because again, these boundaries that we think of don't really matter to patients, and so I think we need to. One of the things that we've worked on in this community, and I think we've done very well, and we at Access have benefited from, is the healthcare organizations coming together around specific issues that impact our community and are very hard to deal with, like mental health care, or dental care for children in the schools. We've got some really impressive collaborations that have started around improving those things, and we really need to shine a light on those activities and keep them moving forward. And I think that's a place that the county can help as well.
And when you mention collaboration, you're looking for the county also then to be a collaborator with you with the other services that the county might influence or directly offer, particularly for your population, if I'm hearing you right.
Certainly, and the county funds a lot of these programs. For example, programs that help people with mental health disorders. And so, again, partnering in a way that we all understand what the resources are out there, and we can communicate that effectively to the people that need them.
Thank you. Thank you for your work as well. Yes. Yes.
Shiva Vidarsila, I'm the Director of Community Partnerships at UW Health. I just wanted to talk a bit specifically also about the things that I feel the county can really do to help our healthcare environment in Dane County. One is we haven't talked about public health, which is kind of surprising since that is really something that I feel is part of our healthcare environment that is very critical to the delivery of services and also to making sure that there is good access. And certainly for those of us who work in healthcare, and a critical component to connect the dots between the different healthcare providers and how we deliver services to those who need it the most in our area. So making sure that public health is at the table and making sure that we look at public health as strategic planning for health with a big H in our county. And looking at the Wisconsin 2020 health plan that we have from the state that talks about healthcare disparities. And I think that's where Dr. Loving was going, and about how do we make sure that those issues of poverty, of disparities that we see in our county already, and that certainly have plagued other counties like Milwaukee, do not continue to grow in our county, but that we really try to do something about it because they are going to influence economic development in our area. So that's one, the public health as a way to bring us all together as a group. The other area is workforce development, and I think the county can really be a good conversation starter and a good forum for discussions about workforce development in healthcare. Again, that's one area where we've seen that despite economic downturn, there's been a growth in need for healthcare workers. And as Dr. Loving mentioned, there's a great connection between those who really need to attain good paying job, and the availability of jobs in healthcare, and how can we connect those two sides of maybe even our businesses where we're providing care to those who are living sometimes in poverty, and on the other side we're seeing a need for good workforce, a stable workforce, and a much more diverse workforce, because we are taking care of much more diverse patients than we were previously. So working again with partners in workforce development would be really important, and I know there are a number of them here in the room. I'm sure they'll talk about what they feel the county can do to help that, but that would be another area. And then the last area that's a big topic of conversation, I think, is transportation. And I think the county can play a big role in issues of transportation, both for workforce and for patient care side of things. And how do we look at our region and transportation connections that will bring people to be able to get, again, to their appointments or to their jobs in healthcare.
Great, thank you, Shiva. And you mentioned, I want to just bring this up in case someone else would like to comment on that, because we have asked the county to be a connector, to set up a forum. You mentioned the study, the 2020, that Governor Doyle actually commissioned, and that many people in this room might have had a hand in constructing, that already set out a lot of information. It already established a needs order of what should be addressed, and it already established how we were doing in some areas, and particularly in public health. And I guess my question back for consideration and some discussion is, where do we start from scratch, and where do we take what is already there? How much of what is already there and available to be a platform is still valid today, and how much do we need to start from scratch? That's just my own thinking as we go. And I do want to extend all the way out to the room, but Chris, I do want to come back to you on that question, because when it comes to quality and setting measurements, that's your area of expertise. You're aware of what I'm talking about. I hope I'm representing that correctly. Where are we? And what should the county executive know about that plan, or should he use it, abandon it? Where are we?
Well, there's our organization, WCHQ, is owned by many of the provider organizations in the room. Meritor, the UW, St. Mary's, Dean, UW Medical Foundation. And the purpose for which our organization was created was to build a mechanism to begin to help provider organizations measure their performance, benchmark themselves against each other, to identify opportunities for improvement, and give to people or organizations like Cheryl's and to lay people better information with which to make decisions about where they might go for treatment. It's a, I think we've come a long way in the last 10 years. 10 years ago, the conversation was very combative around the issue of performance measurement. Quality couldn't be measured. It's in the eye of the beholder. You know it when you see it, those sorts of things. And I think we've demonstrated both the political will, and we've created the infrastructure to begin to do that. We've taken necessary steps, but they're by no means sufficient. The information that we make available is promising, but we don't have good information on clinical outcomes. We don't have good information on cost of care, efficiency, value, the intersection of quality and cost. And most important, along the lines of the last comment, we don't have good information on patient-reported experiences of care and outcomes of care. Are the interventions that good organizations like Meritor and the UW and Dean and St. Mary's are providing to people really making a difference in terms of their lives? So we've got a good start, but we've got a long way to go. And I would just really applaud the last comment about the importance of transportation systems and education and the role of public health, because for all of the attention that we focus on healthcare delivery organizations and the cost associated with that, it's really a minority of the total spend in healthcare, and we have to begin thinking about broader determinants of health, diet and exercise, and some of the impediments that keep people from living healthier lifestyles. So I really appreciate the fact that that was brought into the equation. And we've got some good metrics there, not through our organization, but through the efforts of the University, the Population Health Institute, and the survey of the Health of Wisconsin. So if we knit it all together, I think we've got a pretty good idea of where there are some opportunities for improvement.
Okay, great. Yes.
Hi. My name is Bruce Sylvester, and I'm the city planner for the city of Verona. If I could, well, first let me welcome everyone to the city. And if I could just take a minute and maybe throw out a question that's going to be a little different than what people who are here from various healthcare providers might throw out there. And it has specifically to do with a suggestion for how the county could help with economic development and job creation, and specifically as it pertains to healthcare providing. There's an obscure entitlement. I know the county executive is familiar with it, but many people in the room may not be. It's called an Urban Service Area Amendment. It's an entitlement that allows a city to grow and accommodate economic development. And just to give some examples, maybe to put it into perspective for people, the facility you're sitting in now and the company that owns it is here because about 8 years ago, the city of Verona received an Urban Service Area Amendment. And that allowed Epic to move here, which is great for the city of Verona, but I think more importantly, it's great for Dane County. But that's not the only example. I'm familiar with UW Health. I think they have a new facility in Belleville. That required an Urban Service Area Amendment. Meritor and their new facility on County Trunk Highway PD required an Urban Service Area Amendment. And then closer to home, here in Verona, Dean Health Systems owns some land that we here at the city for over 5 years have been attempting to get added to the urban service area. the county can play a very important role in helping, or has helped in those examples and can help in the future by the appointments that are made to an obscure group. It's called the Regional Planning Commission, that has oversight over these urban service area amendments. When urban service area amendments are approved, economic development can happen quickly and smoothly, and it eliminates a lot of the uncertainty. When it's held up with conflict and delay and uncertainty, I think that prevents or delays economic development or the construction of the facilities like those I just listed. I guess just a final comment, and I wrote this idea down as I was sitting here, but I think cities are the table on which economic development occurs. Cities provide the utilities, the infrastructure, the workforce, the schools, and the amenities that employees look for, libraries, restaurants, cultural facilities, etc. And I guess if I could have a specific suggestion for the county executive and Dane County, it would be to work cooperatively with cities, specifically with the Regional Planning Commission, and specifically on the issue of urban service area amendments to help promote and facilitate economic development.
Great comments, thank you. Yes?
Yeah, my name is Ed Clark from Madison College, and I want to test an assumption and ask a question. It's my assumption that the fact that we have so many locally owned healthcare entities, Meritor, St. Mary's, UW, Dean, is important for economic development. It's important to be able to have people sit at the table and make decisions and not have to refer back somewhere else. And it's important for a whole variety of other reasons. So if that's the case, and I'd like to ask if it is, I just watch large healthcare organizations moving into the Madison area at a fairly rapid rate, large corporate healthcare. And I just wonder if there is, if we'd like to keep local ownership as an option or as a value, is there a role for the county in that?
Anyone care to comment on that? Okay.
I'll give it a try maybe.
Okay.
I moved here 5 years ago from the East Coast, and one of the things that struck me as not only very positive for our county, but I think also very unusual, is the fact that we have provider-owned health HMOs in the community, so you don't see the big commercial health plans in town. I think that is very unique. In fact, I haven't been able to, in my research, I haven't been able to replicate it in other areas, but I think that has allowed for a level of stability in our market historically. And I think it has allowed partnering with hospitals, with physicians, and with insurers in ways that hasn't been done before. And I think it's unique. I don't know, to be honest with you, how sustainable that is long-term with where healthcare is going. But I think the locally owned aspect, Meritor was formed by the community, is owned technically by the community. The university is a state institution. St. Mary's is part of a system out of St. Louis, but has a very strong local presence. I think that has benefited us. The fact that there's a lot of stability in the healthcare marketplace here, and people know each other, and despite what the headlines say every now and then, there is quite a bit more collaboration than there is competition. But again, what will the next 10 years show? But my own feeling is that the fact that health maintenance organizations and multi-specialty physician groups that are working as part of hospitals, I think that's created a very unique environment to test a lot of things that would not have even been remotely been able to get off the ground in other markets. And I don't know if Chris in particular has any comments on that when you look at quality and how quality, and again, I would agree with everybody who said that we're not perfect, we've got a long way to go, but I do think we have a lot to be proud of still. But I think that probably has enabled the creation of an environment where there is more sharing of data, there is more best practices. How are you doing it? How can we learn from it? That has occurred, and that is really a tradition, and I think in our marketplace between the institutions.
Okay. And we're going to set that Do you have a comment to that question? Yes.
Thank you. I'm Michael Heifetz with D Clinic and St. Mary's Hospital and its parent SSM Healthcare, a not-for-profit Catholic system. As Jim mentioned in St. Louis, although to St. Louis's frustration, they always get to hear from me and others about how Wisconsin and Madison are different parts of the system. And we often have to educate the rest of our system on why Wisconsin and Dane County and Madison are different, and for all the reasons that have already been discussed. So, to Chris's earlier comment that we've done well, we have a long way to go, that's correct, but you know, some folks haven't even heard of the work that types of organizations that you run do. So we need to recognize those positives. And I even gave a presentation to a committee of the Missouri legislature a couple of years ago, and they were astounded at even my very novice level of expertise on this, about all the things that are going on here positively. But so let me try and wrap up a couple of the things that have been said. To Mr. Sylvester's comments regarding the urban service area, et cetera. As all of us know, just sitting here, this city, Verona, does not look like it did 5 years ago, let alone 10 years ago. So there needs to be some recognition, while we balance sprawl and development, that folks are moving, and in some cases they've already moved, so we can't necessarily prevent that from happening. We can prevent future things, but once there's a population base, we need to recognize they need some services. So I would echo some of Bruce's comments on that. And to Dr. Loving, he hit on a number of issues, and Shiva also hit it on the head with the disparities. And that brought us around to Jim's comments about collaboration and cooperation, because you do see the headlines of competition. You don't hear where we cooperate. We cooperate quite a bit, particularly with Access Community Health Centers and various other initiatives that provide care and guidance to the underprivileged in our area. And that would likely be, or those areas would likely be very good places to start if we're looking for new areas where we're all going to sit down together and try and resolve some of these issues. You know, it's probably not rocket science that we should go where we already have pockets of cooperation so that we can expand upon them, rather than necessarily trying to start anew in some difficult environments. And as we get into workforce and education, Dr. Loving, again, he really hit on the head that we would all like to see the folks coming to our offices that are struggling, that they would have a good paying job with benefits, et cetera, so that they wouldn't struggle in that way. And as we all know, that's also better for everyone's health care as well. But for us at Dean and St. Mary's, we have significant hiring going on all the time, as probably every other healthcare entity does here. But there are gaps in where the system provides folks with that education. And these are not PhD doctor level positions, but they are good family sustaining jobs with benefits that match up with what we're trying to do in Dane County. So even last year, half of the positions that we were looking to fill, most of those did not require even a college education. Most of those were 1 or 2 year degrees. But again, they provided good benefits, family sustaining salaries, et cetera. So we're not that far away, and a lot of those programs exist today, but hopefully the county can help us focus in on those and collaborate where we can, because there's clearly an opportunity where that gap exists. Thanks.
Michael, the county executive would like to know the gap that you perceive between having these wonderful jobs that at least are able to sustain a family, wonderful in that way, having the need for the populace and not having a trained populace. Where's the disconnect, and how can the county, in essence, help you bridge that?
The gap often comes in post-high school with that system. It can be at the colleges, and I know Ed has worked on these issues before as well. It's not a question of saying the colleges are wrong and the university is wrong. It's just we need to allocate resources appropriately in the education system to folks who may not be going to a 4-year college for whatever reason, whether it's financial or otherwise, because the healthcare community particularly provides those jobs. So you constantly hear about the nursing shortage and the radiation technologist shortage, et cetera, and we keep trying to hire, and we talk to folks about that gap, but there's progress towards filling it, but we just haven't all solved it, and it's not necessarily just the county executive's job to do that, but with the spirit of what we've been discussing, the county executive's office clearly has, the substance to bring that conversation to a higher level and to get us focused around it a little better here in Dane County, because the healthcare community can provide the kind of positions that folks are trying to get. I mean, everyone talks about jobs, but then of course we have to have the conversation about what kind of jobs we want here in Dane County. And we want those good jobs here, and the opportunity is there to have them.
Before I ask you, Ed, and then we're going to go to you, George. I know George has some points to make as well. In a discussion that I had with Don Madeline when he was the head of Persing, asking why they didn't have nursing classes, he said because the ROI is so difficult on those because of the difficulty in finding nurse educators, and that the cost of the class, they can't recover any money in that for at least 7 years because of the cost to educate. Are you looking to the county, if that were the scenario, and Ed, you can comment on that better, are you looking to the county in that role then to be a funder, to do some underwriting for this type of development? What do you see, Michael, as far as the county's reach for this for you? I just lay that as a backdrop that may or may not be an accurate one. It's the one I understand.
Actually, I thought you were going at Ed with that one because that was...
I'm coming back to you first, and then I'm going to Ed, and then I'm going to George Hay now.
So, I didn't actually follow your question entirely.
Okay, well, the question was if the issue of not having enough nursing, I know that we're building a new nursing school, but we probably could fill 3 right now with applicants wanting the education. It's not a lack of people wanting it. If it's the cost of educating them because the shortage of nurse teachers, et cetera, and the cost to deliver the education is the barrier, what role then would the county have to help be your bridge? Is there a role in that? That's just my question.
There very well could be a role, again, just because of the stature of the county executive's office versus us as individual enterprises and caregivers, can really carry that message of economic development along with education, and here's where educational resources should go, if he concurs with what some of the discussion is here today. Obviously, he doesn't budget for various entities around the state, but the county executive, you can clearly focus on where you want our county to grow economically, and that's outside of any competitive issues. I'm talking about vacancies that we have now in our current capabilities. So it doesn't have to get into that kind of debate. It can really focus on just, this is a place where Dane County clearly excels, and that needs to be recognized and fostered. So you would have to do some lobbying just as all the rest of us would, but you have a great story to tell here in Dane County. We can help you tell it.
Excellent. Ed, any addendum?
Just a brief comment. My colleague Pat Schramm and I are constantly trolling the federal grant highways and byways to bring resources into the community, and I would tell you that the more that our community could speak with one voice and our region could speak with one voice, the more that we could point to an active and vibrant collaboration that's happening between the communities, the healthcare areas, it writes itself. And those are the things that bring resources. That's one answer to the question. But I think if we really were able to have a much more active vision and people really at the table and collaborating and identifying needs and working on problem solving, that's exactly the people that the feds and others want to give money to.
Excellent. George Hagenauer is with 4Cs. George, you asked to talk. Is there a point you'd like to make about access?
Let's see, is that working? Oh, good.
Yes.
4Cs is basically a child care support agency that works. It's a nonprofit. We've been around for 40 years. In fact, our 40th anniversary party is on September 10th in Fitchburg. And we basically work on supporting child care in a 9-county area. And I've been basically attending these to sort of talk about how specific areas that have specific needs tie into the child care market. And this is rather an interesting one because every hospital in our service area, except the UW, because UW has a $1 million child care program, has a child care center. And they subsidize it to a good degree, if my understanding is correct, having worked with the directors of Meriter and at St. Mary's. That's equally true in each of our outer counties. So for the healthcare system, especially the hospital system, to work, there needs to be that type of support structure, and part of it is to deal with the attracting of younger nurses, doctors, and those types of people, but a lot of it is schedule issues. The fact that they work totally off the normal types of scheduling that quite often occurs in a lot of businesses, or at least they have a significant number of employees. So I wanted to bring that up because I think people don't think about that as they're dealing with that. And I think what sort of stems from that is sort of two concepts. One is that at this point, we're doing a lot of developmental work in childcare. We have people coming to us who want to start childcare centers. There's no linkage between us and an easy knowledge base. And this is not necessarily related just to healthcare, this is related to the whole thing. As to, like, I know how many kids are in childcare where. I don't know where things might be developing where they could need a childcare center. So if someone calls me up and has money to invest and start a childcare center someplace, currently I'm not certain where I can get that data. I can give them data in terms of what exists so that if they can pull that data together at the local level, they can do it. But I can't say, look here's your good shots, here's your 3 good shots. And so one of the interesting things this year is that this year and next year, the state doesn't require a rate survey to be done by the county. That frees up about $1,000, which is about 50, 60 hours or 70 hours of work time. It might be useful to use that over a 2-year period to really look at how we integrate childcare closer into the economic development structure, given that, one, we're dealing with the brain drain. This is about one of the few places in the state where we aren't losing a whole chunk of young people, some of them moving in. We're looking for a professional class, and the professional class predominantly are people who've gone through a significant amount of education and are starting their family and they're starting their career. And we happen to currently have one of the best systems in the country for doing this. We just are missing a couple minor pieces in order to make it work. So that's one suggestion I think you might want to look very carefully at, and that is we've been identifying childcare within the county solely as a low-income structure. We're using that low-income structure quite often to facilitate a whole bunch of other types of things. We might want to do some serious thinking about that. The second thought that came out of mind as I really looked at the healthcare structure is it's one of the few economic structures that realizes that certain types of childcare are not economically feasible because of schedules. What we've seen over the past 4, 5, or 6 years is an increasingly a shift to the use of childcare only on a part-time basis, and those are full-time centers. That causes losses at the full-time centers, causes increase in costs for the whole market, which makes it more difficult for you to get younger employees because they have to pay more out of pocket. A major driving force, I think, and I haven't had time to do in-depth analysis on it, but it might be useful to see if we could find some graduate students who'd be interested in doing this at the university, is the fact that there are no standards for the jobs created under the Wisconsin Share System. So as I talk to directors at group centers across here, what they're talking about is basically when welfare reform started 15 years ago, our argument is, are they going to, under the formulas, get good enough full-time paying jobs to get out of poverty? Now we're looking at a lot of people continually being hired at 22, 24 hours a day, a week. They're cycling in and out, they have flexible schedules, it's almost impossible to provide childcare. A lot of people do it anyway because if you're in a low-income area, you have to. But if you think about that, the system then is creating poverty. It's essentially, unless those people are actually somehow moving from that 22-hour position to a 40-hour position, what we're seeing instead is people cycling off of Wisconsin shares every 3 to 6 or 7 months. Then as our economy develops, we're essentially attracting more low-income people in here to fail, as opposed to setting up a system that works. And I think we need to understand that, because what has driven me crazy quite often in my other role in the community is seeing TIF money used quite often for hotels or other types of activities that I know are going to end up with a whole bunch of these people working at them. And therefore, we've just invested a whole bunch of TIF money to get a whole bunch of low-income people into a cycle of poverty, which then the county especially has to pick up in terms of social service costs. as opposed to having an economic development policy or trying to think that out in terms of doing that. And from my experience with local planning is that quite often if you give them really good data, they quite often make very good decisions. So I'd like to suggest two things. One is that we spend some time moving a little bit of time, a little bit of activity from 4C into the economic development end, so we understand better how things are going, so we can develop those types of businesses that need to be developed or they need to be developed. But the other is, I think we need an economic development and poverty type of study group, using people from the university and maybe doing some original research, which isn't that hard to do because there's some pretty good databases, to get a sense of how we actually use economic development to pull these people up, and to look at it as a systemic issue in terms of possibly processes that we're doing that are creating the poverty as opposed to a personal problem of the people who are low income. Thank you.
Thank you, George. I'm going to go back to a housekeeping request. You're hearing a lot of static. You're probably wondering why I don't stop bumping my thing or the speaker doesn't stop bumping it. In fact, you're getting voicemails. If you do not have your phone turned off, I know this from working at the radio station, and in fact, Epic just seconded it. If you do not turn an AT&T phone off, every time you get a voicemail on silent, it's still coming through the microphones. Carol Colby's shaking her head. She's had that happen in the studio too. So I'm going to ask you, can you take your cell phones and actually turn them off? And that should get rid of most of the static that we're having right now. That would really be helpful. You're not painful to listen to when I'm grimacing, George. It's just the static starts to get to me. Okay, next comment. Either a comment on George's, or you feel free to raise a new issue that you would like to see discussed for the county exec. Ask a question that you would like the county exec to consider, or I will go back to my notes and we'll call on people. Yes, Carol.
Since you mentioned my name, I figured you'd be able to call me Carol. My name is Carol Colby, and I'm here wearing a couple of hats. I am chairman of the board of the Alzheimer's and Dementia Alliance of Wisconsin, and it was actually 10 years ago today that my husband passed away from Alzheimer's, so I come to that position personally and professionally. I'm also host and producer of All About Living, the radio program that deals a great deal with aging issues and particularly health issues. And prior to that, I was moderator of Picture of Health for the University of Wisconsin Hospital Clinics. I deal not in the delivery of the healthcare setting, but I deal with people all the time in delivering messages, what they should know. And one of the main points that I try to make in everything that I do, the programming I do, is to have people understand their role in the situation. What is your responsibility to wellness, to healthcare, to bringing down healthcare costs, and to building a healthier community? And Chris, you mentioned the importance of advanced directives. And I'm very familiar with lacrosse research. It's outstanding. It's quite remarkable the difference between those people who have had advanced directives, the end of life, reduced costs of healthcare, and actually the better quality of life and longevity of life that they have had as a result. I also ask my radio programs, what do you need to know? Look in the mirror. Your health begins there. What do you need to know? What changes do you need to make? What do you need to learn to better improve your life and the life of your community and society? And Nino, you mentioned the baby boomers and that growing population. There was just an article in the paper a few weeks ago saying that it is one of the least fit of generations of that age of any in our society. So it seems to me that the patients, the consumers, the people of our community and county have a real strong role in it. One of the people I interviewed is Dan Buettner, who is the author of The Blue Zones. Dan is the National Geographic reporter, journalist who went around the world with a team of researchers from the University of Minnesota, Yale, highly researched, measurable. He doesn't do anything that can't be measured. Actually defining where the 4 areas of the world are that people live the longest. When they looked at the outcomes, the thread that runs through it is lifestyle. Any of the medical people, the doctors that I have on the air, how can we prevent this? What can this what can be done up front. And they list lifestyle issues. First and foremost, it's the first prescription to health. So it seems to me that prevention and incorporating the whole community, and we're all in this together, is a really key factor. And that's something that can be started right away, and it's something the county could do and be the leader in the initiative and be an inspiration and make it fun. It's one thing to say to somebody that you need to lose weight and you're too heavy or your blood pressure is too high, or it's another thing, let's do this together and have an actual activity. And the county could be an inspirer, a leader in a program, some County on the Move or Healthy Dane, and working with the Restaurant Association, the school system, the public employment offices, and the private industries. Wellness programs and major businesses are doing extremely well. Not if they put in a treadmill, but if they have a coordinated program when we're all in this together. And it then becomes cool to be well and to get on the bandwagon. Dan Buettner, after all of his research, started a program, put out a proposal, which Albert Lea, Minnesota picked up on. And they went into Albert Lea, and the whole community got together to be healthy. And the restaurants, and the schools, and the public offices, and the private industries, and the churches. And they preached activities that would enhance their lifestyle. And they measured the results. In 1 year's time, healthcare costs had lowered by, I think, up to 40%, which seems really high, but the article was in Time magazine, so if you believe Time. And they also increased by their measurement the longevity of people. Now they're taking that around the country. They're going to California, and three cities on the beaches of California are going to be incorporating this program. And their idea is it does take a village. It takes a community, one person at a time, trying to be well within an environment that does not inspire. That is very difficult to do. So my suggestion, what the county could do, right now, it doesn't take a whole lot of money. It doesn't take a program or that has to be determined by a lot of officials. It could be just, let's get together and figure out how we can make wellness cool, fun, and inspiration, and get everybody on board. And all of the players can come together and say, hey, this is what I could do. We could put a scale in the town center or something and have a biggest loser challenge, and you can get weighed in if you want. You don't have to do anything, but you can participate, and everybody would have different ideas, and it would be a fun thing to do. United Way is launching a program in September. Wisconsin has one of the highest rates of falls in the country. Minnesota has one of the lowest, so it's not the snow or the cold. And so they're launching a program to prevent falls, to prevent adverse drug events, high costs of health care, and the result of falls. Hopefully, by bringing the percentage of people who fall down, the healthcare costs in this community are going to be lowered as well. And I bet there's lots of the media that would be really interested in a successful program like that, and it would put Dane County on the map.
You and I, media, would be interested.
Yes, and in business could get involved, right?
Inspired me. Thank you, Carol. Any comments to Carol's comment, or any therefore directives or questions of the county executive, or ideas? Okay, well, two of us are inspired. I'm sure it's many more. Different topic? Yes, we've got a hand. Oh, we've got a hand where I can't see. Yes. Push that button till it's green.
Okay. Good afternoon. My name is Tiffany Keel, and I wear a couple of different hats. But the hat that I'm wearing today is one of a very highly educated, unemployed mother. And I've been hearing the different comments as they relate to child care and the disparity that exists between education. And I guess I just wanted to give a testament to that my sons are beyond the child care age. So my issue is now child care. I have a bachelor's degree. I just completed the ONC Health Information Technology Workforce Development Program, which is a very intense 6-month program, and I was one of the graduates of the first cohort. The goal is hopefully within 3 years, there will be at least 10,500 more of us out here that are seeking jobs to help address the switch over from paper to EHR, which Epic is a leader in the nation of. So I think there's another finer issue at play here, which is there are people that do want jobs, and to speak to the brain drain, I am at the point of looking at Illinois or Minnesota or other places to try to find employment, because everyone that is these workflow analysts, system analysts, different positions like that, they all want Epic experienced employees, and we weren't trained on Epic, we were trained on Vista. So if there's a way that maybe Epic and MATC in Madison, Milwaukee, and the other educational institutions that receive this federal funding could actually coordinate that a bit better, so that us that took this training so that we can get into this field wouldn't have so many barriers. I think that would be very helpful, because this is the wave of the future, so it was put to us, is that you need this training. We went through it. There's at least 30 to 40 people in a cohort. So there are a lot of educated people that can't find jobs. So to get this level of training and to apply for a receptionist position at whatever medical institution, that's not a fit. I didn't get trained to be a receptionist. I got trained to be a systems analyst. So I just wanted to make that comment.
Well, we want to follow up on that comment. I'm actually going to ask the county executive directly to ask the question, so that I'm just not in between here.
Let me see if this.
He wants to make sure he's understanding your comment.
Yeah, I want to understand. So you basically, the system you were trained in isn't the one that people are using right now? Is that kind of the crux of the...
Well, the system that we were trained in with Vista, that is the system that the feds, like the VA, they use that system. And that's like at the federal level, the federal different agencies, but the St. Mary's or the Deans and the Epic, everywhere, My Care Health, My Care everywhere.
And how much different is the training you receive? I mean, what would it take for you to be able to cross over into the type that the local folks use? How much additional training, is it compatible enough so that...
That would actually maybe be a question for one of the employees.
Well, actually, what I'm wondering here, if there's anyone who wants to talk to you about employment after this session, just wondering how much it might take, how much similarity there is between the system you were trained in and the system that the local healthcare providers are using, and particularly, I mean, not only for you, but if there are other people in your situation, is this a situation where, 1 week of, hey, this is similar, this is all you do differently, would put you in a place where you can use this, or is it much more complicated than that? I don't know.
I would think so, because I mean, what it is an EHR, and I feel the way we were trained, once you know one, it's point and click, it's a lot more complicated than that, but it's the difference between kind of learning to use Microsoft Word and maybe an Apple computer. It's just the different intricacies. But if they say they want someone that has Epic training and you don't have that, then that's a strike at the beginning.
Does anyone in here know kind of what it would take for people in her position to be able to get the proper type of training to change, to take her skills from what they are now to those that are more marketable? Anyone here from Epic?
I can respond to that. Hi, I'm Jesse. I work at Epic. So the way that training works, or the way that training on our software works, is that there are two different groups of people that get training in Epic. It's the people who use the software at the healthcare organizations that are actually providing the care, and then it's the people like the system analysts, like you mentioned, that are the ones helping install and support that software. The people that install and support the software are the ones that we teach here on campus here at Epic. And those individuals, all the training that we do is for employees of those healthcare organizations. Now, obviously, the people that they send to Epic for training is up to them. I mean, they identify those people, and in a lot of cases, those people don't have Epic experience. And I think what we're starting to see more and more is that people in the healthcare industry value that experience. They want to see that on a resume. We see it all the time, though, with organizations outside of the Madison area, outside of Wisconsin, and outside of the Midwest, that they're putting a high premium on that experience. What we tell healthcare organizations is that don't put as high a premium on that experience. We'll teach those people what they need to know about Epic to be successful and to be good at their jobs. It's more important that they either know your organization or they know healthcare IT. So from an Epic standpoint, I think we're trying to steer the conversation back to don't worry as much about having all that Epic experience. I mean, you can get that Epic experience just coming to Epic to get the training. I guess what I would say to the people in this room is that when people come out of these programs like MATC and like the Milwaukee program and others maybe in the Midwest, is that I would not hold the fact that they don't have the Epic experience against them. Because your point about learning the software and knowing how to configure an EMR, I mean, it's certainly, Epic is not the same as Vista, the VA system or the DoD system. But it is comparable to say that, you know, essentially what an EMR does, I mean, you've got the way that those things are configured and the general things that EMRs do, there are a lot of similarities. And that if you have been taught the 5 major healthcare roles, we've actually looked a little bit at those. I did myself actually this last February at one of the industry conferences and learned a lot about what they're actually training in those programs, and it makes a lot of sense. The roles that they are teaching in those programs are a lot of the roles that we recommend our customers staff. So when they're installing an EMR, we say, you know, you need to have obviously, you know, project managers, you need to have application analysts that are going to help make do the configuration. You need to have subject matter experts who are going to help design the architecture, the workflows. You need to have database system experts, people that are more of the under the hood type of people that do that database level programming. So a lot of what those programs are teaching are the key core things. So I would definitely not hold that against the people that are coming out of those programs if they don't have that Epic experience, because, I mean, you guys are all local. It's pretty easy for them to get that Epic experience. It's just a short 10-minute drive from Madison.
Thank you. So to put it in, if I understand this correctly, in non-computer sophisticated language, if one of the local healthcare agencies were to hire this young woman, she could get a quick class out here and be ready to go with her background?
Well, it depends on how you define quick.
I'm trying to get her a job.
Yeah, put me on the spot here. I mean, what it comes down to is that what you need to know to be an analyst in the software usually involves coming to Epic for anywhere from 6 to 9 days, and you know, taking 2 to 3 classes at Epic and taking a series of projects and tests, essentially, that, you know, prove that you know how to configure the software and that you know how to maintain the software over time, and all that stuff. Basically, just, you know, demonstrating that you know what you're doing with it. So yeah, I mean, it's as, you know, as simple as coming to Epic to get trained in the software.
And is this one of these positions like we talked about before where there is demand right now?
Oh my gosh, yes.
So just wondering if, I don't know, let's go with this a little bit. Is there anyone in here? We have a lot of healthcare providers, and I know you might not know the details of every single thing that's going on in every department and division where you work, but without putting anyone on the spot, if anyone wants to meet up with this young woman afterwards and chat with her, obviously we have a very motivated person who has proven she wants to work and taken the classes and has a bachelor's degree. Am I getting an email?
Has a cohort.
And as a cohort, there you go. And the training's not too far away. So if anyone's looking for someone who's motivated enough to show up to this forum today to talk about this, this is a great example of some of the connections we need to make. It would be great if we could make one today. Thanks, both of you, for bringing this up.
Yes. Thank you.
Bob Morris, I'm the head of Organizational Skills Associates. I have a couple of my clients here today. I'm a small business person from Dane County, and I wasn't going to say anything, but I want to applaud Joe. The fact that this young lady should get a job coming out of here today, whether with Michael or with Jim or somebody else. Good for you, that's concrete. And the other thing that I want to say is I want to give props to Bruce, because I want to second his thing about if we can, from a small business perspective, if we can take out some of these layers of oversight and approval that really encumber the expansion or the building of new business, that would be very helpful. And the Regional Planning Commission would be a good place to start, and I know that you're sympathetic to that, but I just wanted to reinforce it. Thank you.
Excellent. Thank you. Nina?
Yeah, let me just taking some notes and try to see if we can get some consensus for all the discussions that have been going on. One, I want to comment about Cheryl DeMar's comments about economic development, which is absolutely right with the Alliance. This is not about growing industry and greater competition, because that's only going to cannibalize what we already have. It really is about how do we bend the cost curve and reach out with the different partners in healthcare to really improve Dane County. It seems obvious too that everyone sees the key role of the county executives being that catalyst to bring us all together. So what would be the easy things to move into on some issues? Someone had mentioned earlier we have to deal with the myths of healthcare. And I like to describe that as false evidence appearing real. And that spells fear, death panels. There's the best healthcare system in the world, and in fact, when you look at it on a per capita basis and outcomes, we're 23 out of 24 industrialized nations. And so we need to put those to rest, and also to get rid of the kind of fear tactics in politics. The other thing is that as difficult as it is in today's environment, a lot of people think there's too much polarization. But Madison and Dane County, with Fort Hospital, proved themselves in 1999 when Dr. Donald Berwick came out with the Institute of Medicine report to Air is Human. And right away, I was at Meriter, Chris was the head of Alliance at that time, and we saw the hospital circle the wagon to attack the methodology of patient errors with Dr. Berwick. But through Chris's pressure from the outside and those of us who were reformers on the inside, got the three institutions to work together to create a collaborative on patient safety, which led to the state collaborative. So there's already a track record that we can work together, even at times we have to be competitors. I think the second thing is, it'd be great to see if we can get a waiver from HIPAA through Sebelius relative to taking a $25,000 router that I'm sure Epic could help design that would allow all four institutions, the VA, St. Mary's, Dean, St. Mary's, and Meriter, to communicate with all their physicians. In fact, the technology is there to allow even the EMTs to communicate. So you have a patient in the ambulance, you know exactly what the history is. If somebody walks into one of the community access health centers, they know what the history is. And right now you're dealing with some HIPAA regulations, but that could be done. And then I think what Carol had talked about, and that is prevention and wellness. Mental health, dental care are fundamental. There's great things that are already being done in this community. And then the whole thing of healthcare literacy. I think if those are the easy starts, that could be done. And then as for the people at the table, I think Madison Area Technical College, they're a workforce development, and nurses and nurse practitioners play a very key role. Medical college, should they be turning out more specialists, or should they be turning out more primary care providers to help the institutions here to reach out and triage people through a system that right now is fragmented? And then obviously, access community healthcare initiatives. I mean, we like to pride ourselves here in Dane County, but we have a poverty issue and a huge disparity issue in healthcare. And other communities are worse than we have, and we have to come to grips and address that. So then what's the driving force to bring us all together under the economic development? And to me, it's the 80 million baby boomers who right now are retiring every single day at 10,000 a day since the first of this year. And as much as we have healthcare issues, 25% of baby boomers are quite affluent. And then those who remain that still are trying to figure out how they're going to retire, if they retire, they're looking not for the Floridas of the world of retirement in or someplace sunny. They're looking where they can have good health care. And if all of a sudden Dane County becomes that magnet where they bring their retirement wealth and their volunteerism and their expertise to a community like this, because not only are we elderly friendly, but we also provide something that's really important to them, that becomes a growth pattern. But you need to attract that. And attract that is collaboration, and to set Dane County apart from other communities who are struggling with these issues. This county and the people in this room and elsewhere have the intellectual capacity to make this happen. It's a question of putting aside the sandboxes and the silos and having the political will to make it happen. And that's where I think that county exec can use his podium to bring that along. And again, you're stuck with all the human health issues which are rising in this county. And if we can address this early on with mental health and other good healthcare providers, we can lower those costs as well.
Great, thank you for that, Hannah. We also have in the room Deidre Atkinson from United Way had filled out forms saying maybe, and because the focus now is on, as you just summarized it, you know, we're talking about a collective community and trying to make that attractive not only to the people that have aged here, but the people that live here and ideally can find employment here and stay with us and enrich us. Deidre, where is Deidre? Deidre, there you are. Looking over here. Deidre's been on our radio show. Deidre, do you have a comment you would like to make about the community and healthcare and how the county could assist you?
Yes and yes. First of all, I think we have an amazing county here, and the healthcare system is a shining star. And the amount of modesty in this room is tremendous. When I think of the charitable work that Meritor Hospital does, that UW does, that Michael representing Dean and St. Mary's, they do a tremendous amount of charitable work outside of the fact that Access Community Health Centers, as a federal qualified health center, is doing wonderful work as well. And we were forgetting to mention the Mental Health Center of Dane County too, being a very, very important peg in the foundation of our healthcare here. We already have a forum for coming together and collaborating, and that's the Health Council. It was created in 1999, and in 2005, 2006, really got under steam in terms of having a healthcare access pilot that taught the healthcare systems in great ways how to collaborate, particularly in helping to treat the uninsured. Huge success there. That Health Council has gone on to do other good things. For example, one of the things they're making sure right now is that all uninsured children who in the Madison Public Schools are having a primary health provider, and they're also doing that and now thinking about how to expand that for the rest of the county. That's huge. They came together about 2 years ago and said we need to do something about healthcare access and treatment for mental health and behavioral health. When I say behavioral health, I am talking about mental health and addictions of alcohol and drug use as well. And they created a set of recommendations that Dr. Ken Loving and the work that he's been doing some fabulous work with his leadership at Access Community Health Centers in being able to treat people more quickly and with great outcomes in a low-income environment. And he and his organization are to be congratulated. Dr. Loving is now heading a task force to increase more of these best practices in the rest of the healthcare system. With the blessing of the Health Council as well. And Mr. Parisi, you're a member of that Health Council along with Jennifer Alexander, who's back over here with the Chamber of Commerce. So that's terrific, and what I would ask the county to do is you've got a huge chunk of money going into mental health and behavioral health. And what I'd ask you to do is to examine the practices that you're using in Dane County and see whether or not we can't, as the health systems are doing to improve their own practices in mental health and behavioral health, if there's some way that you can't look at systems and ways that you can improve the practices that Dane County is providing in mental health and behavioral health. Last thing I'll mention is the issue of dental health. We get thousands of calls at United Way 211 every year of people looking for help with dental health. Oh gosh, it is a problem here in Dane County. Again, Access Community Health Centers has been a leader in this. I think they've got something like 16 chairs and I don't know how many dentists making thousands of appointments annually for people who sadly let their dental health get so badly that they're doing, having to do great restorative work. Meritor also has an emergency room which has some limited capacity in that area as well. So anything that you could be doing in broadening that perspective and helping us to attend to the dental health issues of the community would be greatly appreciated as well. And so I just want to thank the health community here because they do a fantastic job. We're not hearing stories about poor Mrs. Smith who's on the street and can't find someone to take care of her child. The health system is doing a great job at making sure that our community is taken care of. The healthcare leaders are so committed to making sure that they've got a community hat on when they're thinking about the things that they need to do and the decisions that they need to make. And the things here, I think we can just work on continuous improvement of what's going on in Dane County, and I do mean that in the entire way, is the way for us to continue to go. I don't think our system is broken as it is, simply that we need to push ourselves more quickly to better practices and more efficient use of the dollars that we have.
Excellent. Before we adjourn, we're having some great summaries now. Is there anything that you want to bring up? And then I'll give County Executive Parisi an opportunity to ask any questions he might have for any questions that have arisen. Yes, ma'am.
Maggie, I just graduated nursing school from MATC. Can you hear me?
Yeah, I can.
I also went through the workforce development program, and I think what they can do with that program is ensure that the people that finish the program, because there's a great deal of people that don't, that they are followed and tracked to see that they do indeed secure employment. I mean, it's good. What's the good of giving someone all the training and everything, and then all of a sudden, whoop, the carpet's gone.
So you're at the point where you told me you finished the program, you have to take your boards?
Right, I'm taking my boards next week. But I think, after I finished, workforce development doesn't call. I don't talk to them anymore. They're like, they did their job and they're gone. And I think they should do follow-ups.
Well, you have the ear of Pat's in the audience, Pat Schramm and others, so thank you for the comments, and I'm sure that she would be happy, Pat, to talk to her afterwards as well. Okay, thank you. Well, that's the idea, I think, is connecting today, that we make as many connections as we can and that we put as many ideas on the table as we can, that we create a forum for this kind of dialogue that doesn't begin and end here because there are no initiatives coming out of this room other than to continue this initiative to do more meetings. And so, County Executive Parisi, are there any questions you have for anyone who's spoken or general questions?
Thank you. And thank you, Jody, very much. I appreciate it so much. Before we wrap up, we've done a great job of talking about the issues that we were brought up today. I wanted to ask, is there anyone here from what we haven't covered a lot of, and maybe there are people here from this sector, from the medical manufacturing piece of our economy? We're here in Epic, I don't know exactly how you would refer to the IT piece. But as far as just the economic sector, as far as job creation in the medical field, was there anything else that anyone wanted to add or bring up or cover today? Because obviously the definition of healthcare is far and wide when we're looking at it as a sector of our economy. Okay, great. Well, I think in addition to thanking you, I think Pat Schramm and Danica are up there from Workforce Development Board. I'm sure they'd be happy to chat with Maggie, the almost nurse, afterwards to get her across the finish line. And I'm sorry, I forgot your name. Tiffany, if you wouldn't mind sticking around afterwards, maybe Pat could chat with you too. And I'm serious, if there's anyone here from the healthcare industry who thinks they might be able to help Tiffany out too, or from Epic if you guys have any suggestions. It sounds like she just needs to make that little piece of transition spoken from someone who's not very computer literate. I apologize. It would be great if you want to stick around afterwards if we can all chat. If not, thank you again, everyone, for coming today. I appreciate it very much. This summit, along with the others we've had, have been very helpful. What we're going to be doing, everything's been recorded. We're taking notes. We're gathering all the information from all of our summits. And after the last one, which I believe is next week, we'll be getting all of our moderators back together. We'll be going over our notes. We'll be preparing a report that distills some of the information that we've received. And again, use it to inform not only myself, but the creation of the new entity and part of the mission of the new entity that we'll be putting together in the budget. So thank you again, everyone, for being here. Anything else before I sign off? Anything anyone wants to say? Great, thank you, and thank you, Epic. We appreciate it very much.